Welcome to the office.
Okay, Javier, this is you. This is your x-ray. The complaints are up here, number one. But we need to start down here. And let's take a look and see. So, let's go down to the foundation and let's see what are some of the things that we see. Well, we can see that our alignment is off. We can see that the left hip is higher, the right hip is lower. Yes? Mm-hmm. But you can also see you got a gnarly little bend in this tailbone here. Okay. Do you see this?
Yeah.
Follow. This should be straight.
Mm-hmm.
It bends. Look, it bends like this.
Yeah.
Yes?
Mm-hmm.
Okay. Your hips are still decent, okay? Your hips are still decent. This one is wearing out a little more, but they're still good. And they'll still come back. But let's look closer now at your sacrum. And so we know, number one, we have a tailbone injury. I'm actually seeing it down at S5, closer to your coccyx. Mm-hmm. You see this now?
Yeah.
Okay.
It's so bent over.
It's like a curve.
Yeah.
When we look here through this SI joint, I can see through here, I can see here. It's a little hazy in here. Mm-hmm. And that haziness is coming from the scar tissue. On the right side, this is interesting now. We can see through here, but then something is going on in here. And it's related to your L5, and that's what I'm trying to figure out. Let's change the contrast for a second. And let's zoom in and let's see. Okay. So this is your L5 here. These are the transverses. But I can see the transverse here. This one looks like it's almost spatulated. Yes?
Yeah.
And that's kind of what you were told, that your L5 is fusing to your pelvis, mm-hmm. Correct?
Yeah.
But the issue isn't your L5 and the issue isn't your L4. Those are all compensations. Okay. Let's go to the pelvis and let's look at the numbers. It's going to make perfect sense now. So we have a rotated sacrum on the left. We have a rotated pelvis on the left. We have a 4 millimeter drop on the right. So you told me about that just falling on your hip.
Yeah.
Okay, that we're seeing all that, but that wasn't your initial trauma. Your initial trauma is the tailbone injury. So now let's put it together. The left sacrum goes back 7 millimeters. The left pelvis goes up and out. Now we have an AS major from an ASEX. With an AS major with a rotated sacrum, the book says to do the sacrum. So we will confirm that on the exam. The issue that we need to start on is your sacrum, not your 5 and your 4. Once the sacrum is set, then we can deal with your pelvis. So that's your issue and your foundation. Now let's go back to this and let's see what the body is doing as a result. All right, so it starts to curve to the right side, yes? And what happens? It curves to the right. It starts to come back where? Around T11. Mm-hmm. Yes? Yeah. Then T10 starts to take it off. But because you got all this happening, all of this is compensation to me. Mm-hmm. I don't want to start with any of that. Okay. If I get something in your mid-back around 6-7, I'll deal with it. And the reason why, your digestion is pretty bad too. And what do I mean by that? You may eat clean. You work out, you look good on the outside, but you're not digesting your food.
What can you see on the outside?
I see all this undigested food and gas. You're fermenting your foods, yes.
Even though I fasted for 2 days before coming here. Wow.
It's still there, dude.
Yeah.
Now, in terms of your shoulder, there's a few things going on here, brother. And you can see here, look, this is T1, T2, T3, T4. You got a nice kink in your T4, T5. Your bones are all concave and they're hanging over on the end plates. It tells me again, that's your football, that's your playing hard, that's something. Where I would start with you, now that I see it, parasympathetic, critical atlas, and sacral. That's where I would start. I would do that for a couple of visits unless something screams at me. You have a critical atlas up top. You've heard me talk about it. C2 wedges one way, C1 wedges the other way, and we have a foundation issue.
see.
All this stuff because of this kinking,
Mm-hmm.
I want to wait on that for at least 1 or 2 adjustments.
Sure.
Fair?
Fair enough.
Okay. So this is neutral, right?
Mm-hmm.
We have it's here that it's getting a little bit of a reversal. But what I want to see, I can see C2 is kind of binding on C3. If we go in extension, what happened? They should all move back. These don't move. If we go in flexion, what happened here? Those still don't move. They're just stuck. But the shape of the bones is actually very significant because the bones have like remodeled.
Yeah.
And they're trying to fuse here. So this is not the cause. This is a result. And if anything, it's going to be coming from over here. Okay? So it's not about, I understand the neck is important. Yes, it's all important.
I see.
Okay? What I'm looking at more than that is your C2, dude. Your C2 is not moving. Because when I go in, this is neutral. Extension, it's binding. Inflection, it looks like it's moving here, but it's not, dude. It could be moving a lot better. So this stuff's not going to move right now. We got to fix this first before this starts to move. But more important is we need to work up here.
Top of the neck.
Penthouse and the basement.
Very good.
Okay?
Yes.
But the idea is to make sure you leave clear.
Thank you.
Okay? Let's get started. Next thing we're going to do is look at your walk. Right now, just the way he stands, both feet are out. That's an upper cervical issue. Walk towards the corner of the room and back a few times, sir. Good. Keep going. So that right foot swings out. The left one does too, but not as bad. Let's keep walking. Keep going. So you got a little bit of that shuffle. You got that Mexicali shuffle. So you be shuffling like this.
Yeah.
You have a little bit of movement in the dimples.
Yeah.
But it could be a lot better. And he's tilting on that. So you kind of like shuffle. And then the good thing is you're at least trying to get the movement through your shoulders. That's the good thing.
I tried. Yeah, I tried.
Swing your arms more. Good. It's that left SI jump, brother. Have a seat. It's your left SI jump. Starting at the base of the neck. Looks like C2 on the left, but then it goes to upper cervical on the right. Good stuff. It's not the base of your neck. Looked like it was going to be around 7-8. It was not.
Where was it?
It's swinging around. It's not breaking.
Yeah.
Scoot back for me, please. You've watched enough of my videos. You know when I talk about the swing versus the break, right?
I don't
So
remember.
I'm looking for it to come back to 0. If it doesn't and it goes past 0, that's a compensation. It didn't stop. It keeps going. Comes back. Keeps going. All the way to that left SI joint. So I'm getting upper cervical and I'm getting down in the basement, as we said. I'm not getting it here and I'm not going to chase it.
Okay.
You know what happens when you chase it, right?
What happens to Dr. Rahim?
Anytime you chase it, you lose. Feet together, scoot forward. Open and close the knees, feet touching. Good. Right side only. When he does the right, the whole left wants to shift. Left side only. When he does the left, the whole right wants to shift. So they're both stuck. Scoot back for me, please. Número 5. Número 1. ¿Duele?
No.
Número 2.
A little bit.
Número 3.
Yeah, more, a little bit
Número 4.
more.
Número 5.
Not that much.
Número 4.
It's between 4.
Starts at 4
It starts at 4.
and 3.
4 and 3, yeah.
All right, so we have down in the tailbone, okay? Now let's check up top. So we know we're gonna do S4 slightly on the left side, scoot to the left. And we're gonna confirm that SI, that sacrum with the leg check when we get to that, okay? Now, check it out. 7, 6, 6, 5, 4, 3. Starts there. Dos, right, derecho, izquierda. ¿Duele?
A little bit, yeah. More when you go to my right.
Right there. C2 on the right, C1 on the left. Let's check the nodding.
It hurts a little bit on my left base.
That's occiput. Look to the left, look to the right.
Hurts.
To the right.
Yeah, hurts to the
Look
right.
up, we're isolating the lower cervical, left, right.
Hurts as well.
Look down, turn left, turn right.
Hurts.
Hurts more looking down or it hurts more looking up?
Let's try it again.
Up and right, down and right.
Up and right.
All right, then we need to wait on the neck. We need to do your foundation first.
Mm-hmm.
Have you walk, I gotta recheck everything.
All right.
You don't follow textbook.
Got it.
We're doing the left side, left SI joint. So right now what we can see, the right is actually slightly longer, okay? I'm gonna bend the knee, so the left is short. And, no shit, left goes long. Seriously. Am I seeing that right, yo, camera person?
It looks like the left is long.
Left goes from short to
Long.
long. Hold on. No, it's short. It's so subtle. It's still short. Come on up. You're throwing me off, man. You're making me work and think today, dude. I like it.
Let's go.
Let's do it. We'll go out. So, Mr. Javier does not follow any textbook, and that's okay. Now, he's rotated on the left, but which side is the leg short on? Or which side is the sacrum dropped, Javier?
On the left side.
It's rotated on the left, but it's dropped on the right.
Mm-hmm.
Okay, so I need to be on the left side here, but I need to torque it to bring the right side up. Does that make sense?
Mm-hmm.
Okay. Relax your shoulders, brother. Home run. Gotcha.
Good.
Check.
You got it?
Watch. Walk it up. New walk alert.
Really?
Yeah, dude. Can you tell him?
I feel something off right
What?
now. It feels weird.
Español, tell him. Tell him.
Ya. Estás caminando diferente.
Really? I can feel something different. I don't know what though.
You got your swag back in your walk. That's what you got. Keep walking. Don't stop.
Oh,
It's different.
It feels easier.
Sit on the floor. Come over here and sit on the floor. Mira.
On the floor?
Yeah, just sit on the floor, however you sit. Get up fast. Check it out. Check it out.
Oh man, I don't feel that aching pain right in my lower back.
Move your neck.
Feels better.
Siéntate aquí, por favor.
Neck feels better too.
This is not a paid promotion, people. Starting at the base. Now let's see what the real issue in the neck is. Okay, sir?
Yes, sir.
That clears your neck. No shit. Are you amazed yet?
Yes.
T2, T3. Damn. Damn.
So we got more?
No, we got different. You got layers. You like an onion. How do you say onion in Spanish?
Cebolla.
¿Qué?
Cebolla.
Cebolla.
Yes, sir.
Cebolla. How do you say peel the onion?
Pela la cebolla.
Pele la cebolla.
Yeah, Dr. Rahim, I've been injuring myself for 12, 15 years.
Mira. 1, 2, 3. I didn't touch it. 4.
No pain.
Did you get it?
No pain.
Did you get it?
Sit back for me, sir. Let's check the thoracic now. 2.
Pain. Yeah.
Aquí or arriba? Aquí.
Yeah.
Abajo?
Yeah, that too, but more right there.
Right there. Head down, please. 1, 2. Número 3. Let's go face down on the high-low over there.
Over there.
Número 3. Su corazón, señor.
Mm-hmm.
Huh? Let it go. You see, he doesn't. Home run, baby.
Oh, why did I feel that all the way up to my neck?
Because that's where it's starting from, brother. Mira.
Oh, man.
Caminar, por favor. Caminas.
Ooh, I can breathe better, man. Thank you.
You're welcome. T3.
I had to really put in the work to breathe all the way. To get a deep breath.
Oh, look to the left. Oh, look to the right.
Oh, wow.
Less pain, right?
Yeah, the most restricted movement was trying to put my ear on my shoulder.
Yeah.
And that still is stiff, but no, not so much pain as
Better,
before.
right?
Yeah.
Now, just so we have a comparison also, 3 is clear. Upper is clear.
Are we clear?
You're clear, brother. Look up and left. Up and right. There's more movement.
Yeah.
Still restricted. I'm okay with that. That's
Mhm.
work. You got a lot of work to do. Can I continue?
Yes, sir.
Mira, relax it down. No? Let me check this out even. Watch. Look.
Yeah, it still hurts a little bit, but the movement isn't as
It's smooth.
restricted as it was.
There's no click. There's no grind. Now you get a buff and polish. They all want miracles in one visit. You got it.
Thank you, Dr. Rahim.
You're welcome. Stand up for me, please, sir. Stand over here, please. Squeeze my hand.
Still weak.
Relax. No, 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 no. Squeeze. Remember the onion. We just peeled the first layer. So we're peeling the onion. There you go. Squeeze. Relax. Can you give it to me, please? Give it. Give it. Give it. There you go. That was me. Turn. Squeeze. Hold on. Squeeze. Why not?
Why
Squeeze.
not?
Check it out.
A little bit better, yes.
It's a little bit better, but still something. Come have a seat over here. Let me just stimulate the nerve a little bit. Come over here. I just want to show you, but we're not there yet. I'm just showing you something, okay?
Yes, sir.
We did T3.
Mm-hmm.
Let's get it just a tiny bit, okay? Look up. Look up. That's it. Stand up. Not looking for a big crack. I'm just stimulating the nerve. Stand over here, please. Squeeze the hand. This is good, right?
Yeah.
Mira.
It's a little bit better now.
When we get there, it's actually a lot better, by the way. Squeeze. You're more firm for me.
Really?
Yes, sir. And we'll test it on the next visit as well with the grip strength.
All right.
What you can do this week, there's no weights right now.
Mm-hmm.
Walking, water, ice, as much as you can.
Mhm.
12, 15,000 steps, a gallon at least of water a day, ice the low back and the T3.
I got an elliptical trainer. Can I use that?
2-to-1 ratio, 10 minutes forward, 5 minutes back, do that as long as you want.
All right.
Perfect.
Perfect.
One more time.
Thank you very
Squeeze. Squeeze. Do a couple push-ups for a second. Hold on. You'll tell me how your shoulder and hand is now.
Shoulder feels a lot better.
Better?
Yeah.
Grinding?
No grinding.
Pain?
No pain.
Bueno! Welcome to the office!
Thank you, Dr. Rahim.
Bienvenidos a mi oficina, señor!
Thank you.
You got it.